Hi, I'm David Liew from Melbourne, Australia, reporting for Room Now here from EULAR 2022, live as you can see here from the Bella Centre, end of the day two, Thursday. It's been a great day. I want to tell you a little bit about some of the stuff that came out in the morning session from a session called Vessels Glowing in the Dark. Great title. Kudos to EULAR for putting that together. And in fact, I really want to speak to you about an abstract that addressed vessels specifically glowing in the dark. And that is a study which looked, in fact, at patients with polymyalgia and looked using ultrasound to see whether they had subclinical GCA. Now, we know that PMR GCA related. We know that some patients with PMR end up going on to develop GCA. What we don't know is whether there's imaging evidence of GCA in the background in patients with new PMR. So what this study was actually a European collaborative that's actually been founded out of the PMR GCA study group. Really interesting hearing it being talked about how this formed together across a number of different European centres. I looked at new patients who met PMR classification criteria and actually saw whether, before they had steroids, whether when they examined extracranial vessels as well as cranial vessels, whether they would in fact have active features of giant cell arteritis on ultrasound. So, interesting. First of all, of those PMR patients, 20% had active vessels. Really, I think it's hard to know what that means. So what are these vessels doing? Is this going to behave the same way as giant cell arteritis? Is this a pre-giant cell arteritis phase before which develops in? Or is this always background uptake, knowing the limitations in and of itself of giant cell arteritis, of ultrasound, and the possibility of a false positive, however tightly controlled the ultrasound protocol might be. Interestingly as well, I should say that while most of it was extracranial, and certainly 75% of people had extracranial uptake, still 1/4 had exclusively cranial uptake. And there was a bunch more on top of that, I think another 10% more on top of that, who had both cranial and extracranial. So this certainly isn't just a disease of extracranial uptake that can be necessarily, that might necessarily meet that kind of classical phenotype of PMR-related GCA. But I think this really starts to talk to a question, which has come up a few times here today at EULAR, which is what is this spectrum of GCA, PMR, where does the line sit? And when there's subclinical disease of GCA on imaging in PMR, is that going to evolve into something? Is that not? What do we do in terms of treating that? And I think what's really going to limit this, the study of this, is the fact that if this is added on to PMR studies, then really there's an obligation. Is there an obligation to say, well, these patients have GCA, now they can't go into a PMR study? Do we have to try and treat them with GCA level steroids or not? We really want to see the histopath. And I think that's what we want to try and follow up to see what this means. There's a lot of questions about that, which have been opened up from this study today. For plenty more about all things from EULAR 2022, head on down to roomnow.com.